the weather has suddenly become very cold. Time has changed. We gained an hour, fall back, so daylight savings time. And every year at this time, we kind of think about, if daylight saving times is good for you or not. And obviously, it has its pros and cons, and some actual health concerns that people might have with this. And I can kind of sort of watch for that as well. Office has been very busy, and so we saw a lot of interesting things. My medical students got to see almost the whole textbook this week, and but common things that I want to talk about is like at this time of the year that we've started noticing in the office in general, and you are probably noticing this as well. Is I'll start with like a couple of things that what I saw in the office, and I'll see whatever I can touch upon. So I want to talk about dry skin and dry heels. This is the time when everybody's starting to have that. Rashes, a lot of itchy skin, which is kind of related to dry skin, but some other things that I want to talk about. People are having some changes in their mood, like feeling a little bit down, if I could say that, but they haven't been feeling as chirpy and as excited about life recently. But that's also what we'll talk about a little bit. And another thing I want to talk about is some weight loss, weight gain, some recent news, and what's happening in the world of weight loss. Actually, in the world of weight gain, I saw a lot of patients come back with like a few pounds worth of weight gain, and I think I gained a couple of pounds in the last few weeks. And we'll talk about why that is happening and what can we do about it, and what's my plan to deal with that. And also had some more cases of COVID and the flu, with a varying degree of complexity. Most of the patients have managed to stay at home, but the usual thing that these conditions now by themselves may not be as deadly as they were a year or two ago, especially COVID, but it's still triggering off other chronic conditions and issues in people, and that is making a big difference on how we should manage and how we should be approaching this. All right, so I'm gonna start today with, first of all, like dry skin, and I had a lot of patients come in with itchy skin, itching, and what I noticed was that when they showed me the skin, there was no rashes or anything, just a little bit dryness, but they were having a lot of complaints of itching. So what I noticed was, first of all, and this is my recommendation for everybody, that be aware of temperatures. What's the temperature outside? What's the temperature in your house? And what the humidity level is in the house, and how you are dressed, and are you dressed accordingly. This is when a lot of times I saw some of my older patients especially that they were dressed pretty warm inside the house, and then they would go outside with the same clothes, and when they would get into the office, or when they get back home, they would usually stay in these clothes, but the weather outside might be 35 degrees, 40 degrees, and when you come inside it's like 70 degrees, 72 degrees. So major fluctuation in temperature, but people are not changing or adjusting their clothing to that, which definitely adds to skin irritation. And then the clothing that we're wearing is like warmer clothes, a lot of synthetic and wool, which can be irritating to the skin. So this is what I came across. People were sweating in the winter because of the heavy clothing that they're wearing. So what do I recommend we do about that? One is, yes, when you go out, make sure your head is covered. You're wearing shoes. Warm shoes is also good. So your head and feet are covered. That will help. Obviously, if you're going to be spending any time outdoors. Secondly, dress according to the temperature of your environment. If you're outdoors and it's let's say 40 degrees, dress warm and stay warm. But when you get inside, you take off the hat, you take off the shoes, you take off the extra couple of layers, and then just get comfortable. What is the clothing that's minimum that's making you feel just about comfortable, not hot, you're not sweating inside? To that, I also saw a lot of rashes in the legs, in the groin area, and the thighs. And turns out people have turned on heated seats, and guess what? The heated seats, and they're already dressed very warm, but then they forget to turn the heat off, and that's leading to some moisture in the lower below the belt area, and they're developing rashes over there and having a lot of difficulty with that. But when I believe that the reason for this is rather simple and can be easily adjusted. So just be aware of this. Obviously, if you still have developed a rash and it's not going away, then obviously please go see a doctor and have them take a look, because once certain rashes get a little bit of out of hand, then they do need medications to help you return to normal. But other than that, keep your skin moisturized as much as you can, and drink plenty of water, because with the heat turned on, we don't feel thirsty, but the heat is taking out a lot of moisture from your body. So make sure you're staying hydrated. Have an extra bottle of water once a day. So your doctor is advised not to drink too much water, because there are some patients where that extra bottle of water can be harmful. But for the most part, if you're generally healthy, be aware that you're losing a lot of water indoors because of the heat that's on. And then I had a few patients come in with changes in their moods. A lot of them have been on medication in the past, but they've felt great. They've done okay. And I'm not going to name any conditions per se at this point. But in general, if you're feeling down and almost feel like that you're depressed, the weather changed, the time changed, the daylight savings time changed, the days are getting shorter, you might be experiencing what we call seasonal affective disorder. And that's basically like as the days get shorter, the weather gets colder, you tend to have more of mood that's more on the sad side, and then usually as the spring comes, people start feeling better. But we are like 6 months away from spring, so something to think about, something to consider. And if you've never been on any medication, but this is what you have felt, you should definitely consider seeing a doctor and talking about it. That I usually see this start happening in September, October, and now we're already in November. But this is one of the things that I have been seeing, because as sunset is it's pretty dark at 5 o'clock already. So something to think about. And that's kind of also, the weather got cold and days are shorter. It's pretty dark outside at even 5 o'clock. So a lot of physical activity has gone down. People were exercising. People would return from work. They would go for a walk for a half hour or so. They were doing a lot of things. Now you come home, it feels like it's in the middle of the night, and you start and it's pretty cold outside, so you want to stay indoors. As a result, we're eating a little bit more and exercising a little bit less. So something to be aware of. Usually I've had to remind people, has your physical activity gone down in the last couple of months? And a lot of people have had to think about it, and then they've answered positively, saying that yes, I did not realize that my physical activity has actually gone down. And then there's like the reasons for it, like the fall started. We had a lot of activities, a lot of friends, family, and now with the recent few days that we had off, the festivities, and in Indian culture, these things last for like days at end. So what it has resulted in, the blood sugars going up, blood pressures going up, weight going up, and everything beginning to feel, that it could be better. Just a reminder that physical activity is still very important, and if you are consciously aware that your physical activity is not going to be the same as it was, let's say, a month ago, try to see if you can adjust your diet a little bit. Take out at least the sodas and the sweets and the desserts from your diet if at all possible. And if you can eat one less meal while you exercise less, that'll keep the weight off. Now, talking about weight loss, we've had a new drug that was just approved by the FDA for weight loss. It's interestingly called Zepbound. I don't know why and how this name came around. It's the same drug that's Mounjaro, but now Mounjaro was approved for diabetes, and this one is for just weight loss. Zepbound. I know Zep is a chemical that they sell at Home Depot, and bound is like homebound kind of thing. So funny, but the drug is really good. So whatever it's worth, Ozempic has been the drug that everybody's familiar with, but Wegovy was or is the same drug relabeled for weight loss and approved for weight loss. So now Mounjaro was a good competitor to Ozempic, and now Mounjaro has their own weight loss approved drug. They are good drugs. They are working, and the latest study that I read today, in fact, shows that this class of drugs actually showed a 20% improvement in heart disease. It's still new, but I think the way this is going, that the people are losing weight, which makes them obviously healthier. They're eating less. Their diabetes is improving. As a result, the heart disease is improving. So overall, this is turning out to be better and better. There's obviously stuff out there on the internet about the side effects, which obviously are vomiting and nausea and things like what you're listening. They are exaggerated versions of common side effects, but your doctor should explain them to you, or you should discuss it when you first encounter it. So far, I'm in favor of the drug. I've had a reasonable experience, about like 3 or 4 years with this drug. Intermittently, I've never prescribed it as weight loss. Mostly my diabetic patients have been on it, but recently people have used it for weight loss because they were pre-diabetic or they just wanted to lose some weight, and their insurance approved it for them, to my surprise. Long story short is I got notices from the insurance companies that they are not approving this for weight loss. They need like extensive prior authorizations, and so that they can still deny them. The drug price went up. It has doubled. When 2-3 years ago, when nobody wanted to try Ozempic, nobody was using these. They did not want to go into any needles, didn't want to touch any needles, and the drug was costing around $550. Now it's at least $1,100, and the insurances don't want to pay you. Can it make you nauseous and sick? Yes, absolutely. That is the most common side effect of these drugs, but the idea is that this drug, how a person feels on this drug is that they just don't get hungry. So how people are used to eating, at certain times, your brain will always get hungry at breakfast time, lunchtime, and evening at dinner time, or if you're used to snacking at certain times, it will make you hungry. But while you're using Ozempic or Monjaro, that signal never comes. Your stomach kind of sort of always feels full. And when the stomach feels empty, that's when the signal goes to the brain that it needs to eat. But while you're using these drugs, the stomach always has the signal that it's full. And now that's how the body is perceiving it. So when you eat a heavier meal, uh, it almost the stomach and the brain are tricked into thinking that it was already full, and now you ate a lot of food on top of that, and that creates the feeling of nausea and fullness. And then whatever you eat also tends to stay in the stomach a little bit longer. It's almost a mild form of gastroparesis. That just the food transit from the stomach and the digestion process. It takes a lot longer. But the idea is that the brain is tricked into thinking that there's a lot of food or the stomach is full. So a simple way to be aware of how to deal with that is first is eat less. You will probably be eating, if you're on any of these medications, you'll be eating very little, and that's okay. Be aware of that. Don't finish that plate. Don't eat lunch because it's lunchtime. Don't eat breakfast because it's breakfast time. And now that has to be, I have to remind my patients who are on other diabetes medications that they have to be very careful measuring their sugars, because then they can get hypoglycemic. That means their sugar levels can drop. So there is something to do, but the point is, if done right, people can tolerate this medication very well and lose weight. And when you lose weight, you get healthier. Simple. You can then get nutrition. Then you go into the second level of eating healthier. First is eating less. Second is eating healthier, where with less food you get more nutrients, more vitamins, more minerals, and all that stuff. And organic is better, at least if it is actually organic. But yeah, that's the thing. So new drugs on the horizon, successful, great. Insurance don't want to pay for it. So insurance don't want to pay for it yet. But I think with this new finding that it's helpful with heart disease, and 20% improvement in heart disease. That's significant and that's phenomenal. I have a feeling that if not this year, next year, the New Year's resolutions are going to be much more successful. Everybody's going to want to lose weight, and if their insurances will cover that, they will definitely lose weight. And I'm happy that this is likely going to happen. For now, unfortunately, it's a different story, but I think that there's a light at the end of the tunnel. You're walking as often as you can, 3 to 5 miles a day. That is absolutely phenomenal. If you can walk even 2 miles a day, even let's say 6 days a week, it takes about 33 minutes to walk. If it's taking you any longer than that, then you gotta walk a little bit faster than that. But in general, if you can do a 2 mile walk in 30 to 35 minutes, that is excellent. I was doing that probably 4 times a week. And I felt much better, and I was losing weight just by walking about 2 to 2.5 miles every other day, or about four times a week. In the last month, that has gone down because of some knee issues. I wish I could say it was because of all the festivities, which did contribute, but it is what it is. But right after this podcast, I'm going to walk a few miles, and definitely that's the best thing you can do. So we talked about the new drugs, Zepbound and Wegovy, Ozempic, Mounjaro, and you got to add that and some exercise. You're going to be great. And walking every day is absolutely awesome. Keep up the good work. You will stay out of trouble. and and then and we talked about the nausea with the Ozempic and these drugs. Just have to kind of manage it, set expectations, and think you'll be all right. Hopefully, these drugs will be much more readily available and cheaper. I don't think for something that actually works, it's reasonable to be paying that kind of money. It's just not fair, and that's what I would suggest. Again, a reminder: if your mood's been a little bit, on the downside, feeling sad for no reason, it might be what we call seasonal affective disorder. Go talk to your doctor about this, and doesn't necessarily mean you need to be on medicine. Clarifying that, just making you aware that if you've been feeling like that lately, that might be something what it is. And treatment options are actually simple. Naturally, it's exercises. Probably 80% of the treatment for those things, and being aware that this is what might be happening, and adjusting some lighting in your house, and changing the wavelength of the lights in the house and how long you expose yourself to that can make all the difference. So something to definitely look into. And moisturizers, and drink some extra water, some moisturizers for your heels. You can need to file the heels a little bit, not the heels, but if this was the heel, file that area and clean it and moisturize it every day. Will make a big difference, and you will not develop those heel cracks or cracked heels. But if it still happens despite all that, go see a doctor, and they can obviously prescribe some medicated creams that help it heal better. And that's all I had to share. But if anybody has any questions, I can continue and try to answer any specific questions that you might have. And one of the things that I did not touch upon, but I was hoping to, but maybe we can do that at another time, is I had a few patients who, unfortunately got diagnosed with terminal illness, and hospice came into the picture. So, and usually I'll see someone here and there, but this week was like a little, and then we had more than one patient who required hospice. So, if you or a loved one have been diagnosed with terminal illness, please, I'm sure the hospitals and the health system has given you and introduced you to hospice enough. But if not, feel free to ask me, and if you need me to talk more about it, I will. This is something like I think it's heavily misunderstood by the patients and the providers alike. And when we don't, if the patients, the caregivers, the hospice team, and the patient's doctors, if not everybody's on the same page, it adds a lot of confusion and maybe even dissatisfaction. So I think if you do have any questions or need any clarification on hospice, home hospice versus inpatient hospice, and what you can and cannot do, I'll be happy to talk about it. It'll probably it'd be better if you have like particular questions. I'm more than happy to answer that. But I think we'll end it with that. Thank you very much, and just let me know if you want me to continue doing this. If you're gaining anything from this, please share it with your friends and family. And obviously, the more questions I get, the more I get to answer them. More this helps you, and it helps me because it helps me stay on top of my game. Thank you very much. This is Dr. Vikram Gupta. I will see you next week.